Hamilton County Public Health inspects septic systems throughout Hamilton County with the exception of Cincinnati, Norwood, Springdale, Sharonville, and Indian Hill. This video shows just one example of a system we may encounter, which in this case is an Oldham Aerobic Treatment Unit, or ATU for short. A technician in our Water Quality Division recently inspected this system in Green Township. In a 500-gallon per day Oldham system, there are 4 lids leading to different chambers of treatment within the system. The first access lid typically contains an inner lid which helps keep odors to a minimum, because this chamber is where raw wastewater is stored during the settling and separation phase of treatment. Here the technician is looking for proper baffles, signs of infiltration, and obvious need for pumping. ATUs should be pumped every 2 to 3 years with normal usage of less than 250 gallons per day. The resulting clear effluent from the first compartment moves into the second compartment of the tank. The second compartment is the aeration chamber, where a majority of the treatment happens. On an Oldham system, there is typically a light on top of the lid that covers this compartment. The light turns on to notify the system owner if the motor on the ATU is not in working order. The riser over the second compartment houses the aeration blower and timer. This system has a timer that is not approved, but according to Health District records has existed in the system for many years. The next time the system owner replaces the timer, it will have to be replaced with an approved timer. System owners should always verify with the Health District that replacement parts such as aerators and timers are approved prior to purchasing replacement parts. It is customary for our inspectors to switch the aerator on to verify the system is working correctly, as the technician does here. The technician is looking for many signs of problems here, such as foul odor, incorrect timer setting, and clogged or broken air lines. Effluent leaving the second compartment enters the clarifying chamber, where final settling of any solids or floatables are separated and returned back to the aeration chamber. In this system, that is accomplished by mechanical skimmer when the system is actively aerating, and by gravity settling when the aerator is in its rest cycle. Not all Oldham systems have mechanical skimmers. In systems without a mechanical skimmer, floatables are trapped in the third compartment by the outlet baffle and must be removed manually by a registered contractor on a routine basis. Most ATUs need to be serviced at least every 6 months. Amongst other things, the technician is looking for signs of proper service and a working baffle when inspecting this compartment. Under the fourth lid, the technician gains access to a separate chamber that is actually a completely different tank called an upflow filter. As the name implies, here the effluent is filtered through a gravel bed where final polishing happens. In Oldham systems, the upflow filter is aerated to improve effluent quality. Again, the technician looks for signs of infiltration, poor effluent quality, proper aeration, and signs of effluent or the filter being bypassed. The technician also ensures that the upflow filter contains chlorine to kill off any pathogenic bacteria prior to the effluent being discharged to the environment. Once the technician is finished inspecting the system, he fills out the proper paperwork and uploads it to the Health District databases. The system owner will typically receive the inspection results and associated invoice within a few business days. For more information on septic system inspections, go to www.hcph.org.